hydrotherapy really shouldn't hurt. It is a gentle infusion. We're not going in there and pressure washing anything. It is so gentle because it is a gravity fed device, and the particular device we use, the Ultimate Concepts Cleanse device, has been registered with the FDA as a non-medical, non-prescriptive device, and it got this registration because it is so gentle. There are some individuals who might experience mild cramping with colon hydrotherapy, and generally these are people who are prone to getting mild cramping with diarrhea, and we have at our facility heating pads which help to minimize any potential cramping and to keep circulation to the area. The rectal nozzle that we use, as hopefully you can see on this video, is very flexible. Not too flexible that it'll just, you know, move around during the process, but is flexible enough to have a very comfortable insertion. At no given time will more than 3 inches be inserted, and as you can see, it is very thin. It's about the size of a number 2 pencil. It is a self-insertion. Your therapist will not be inserting for you, and the rectal nozzle will be brand new and lubricated to make the insertion more comfortable. Unfortunately, this is the misconception that keeps the bulk of people from partaking in this beneficial service. They make the assumption that they're going to be exposed or embarrassed in some way, and it's just not so. Because we have an open system, we do not touch our clients at all other than maybe a handshake, and we are there solely as a coach to help them, instruct them on how to get up on the device, how to insert their brand new lubricated rectal nozzle, cover themselves up, and then they'll page their therapist and we will give them further instructions. At no time should they be exposed or embarrassed in any way at all. The potential of embarrassing odor is another misconception people have about the colonic process. There are 2 separate things built in the device, an exhaust fan and a fan spray, which helps to eliminate and reduce odor. If there is an odor, it is usually temporary, and by the next release will be completely eliminated. Most people find that is no odor associated with it, and as you'll be in the process by yourself, it's very private anyway, so that's definitely should not be of concern. Is it messier? Will I need a shower afterwards? This is a frequent question people ask, and I generally joke with people and tell them, not unless you're some kind of freak of nature. You know, it's really no different than, you know, using a restroom. Built on the device is a sprayer hose that you can clean up afterwards. We also have baby wipes. We use disposable drape cloths, and most people just clean up with the drape sheets themselves. Some therapists actually have toilet paper. The only thing is we just ask that all trash gets put in your personal Ziploc trash bag. Nothing gets thrown down the bed, and I joke with people too that I don't want to call the plumber. So, you know, people generally understand. They'll be throwing big, huge wads, you know, of cleanup material down the beds. And basically that's it. Surprisingly, it's very, very clean. This is a popular question from our female clients. They want to know if they need to reschedule when they're on their cycle. We have a number of clients that actually come in a day or two prior to starting their cycle and find that that helps them to reduce cramping, bloating, and the digestive changes that they can experience through their cycle. The only thing I do recommend they do during the process is if they are wearing a tampon, to make sure to remove it prior to, so they don't accidentally contaminate themselves. And that's another benefit of using an open device. Anything that would get flushed away will go down the device. This is a common question. I think this misconception comes about from a lot of the kind of horror stories that they've heard through various either laxatives, you know, herbal cleansing type products, where people find themselves running to the bathroom constantly. Generally speaking, by the time you get off of the device, you are pretty well cleaned out. Occasionally you might have a little bit of residual water left in, and that, you know, would basically be very similar to just having a normal bowel movement. You wouldn't, oh, I'm gonna have an accident, nothing like that. By the time you get off that device, you should be pretty well cleaned out and fairly dried out.